As a child and throughout my life, I have been around family and friends who have smoked tobacco. I have been fortunate to not lose anybody to the many diseases attributed to the tobacco use, and have seen and experienced the effects. Such effects include my aunt having surgery this past Tuesday for 2 hernias which could be attributed to the excessive coughing of smoking, as well as myself suffering from asthma the majority of my life due to my parents smoking around me as a child. Today, I will first talk about the history of tobacco and the history of the growth methods and uses. Next, I will talk about today's growth methods and uses, and finally, the effects that tobacco has on first-hand smokers and second-hand non-smokers. I will begin with a brief history on tobacco. The Maya were the first to use tobacco and introduced it to the Native American Indians. Christopher Columbus observed the Arauca Indians of the Caribbean using it in a tube called a tobago. According to the tobacco article of the Funk and Wagnall New World Encyclopedia on the EBSCOhost database. In 1556, Jean Nicot, a French diplomat, introduced tobacco to France. His name derived the plant's generic name and key ingredient, nicotine. In 1585, Sir Francis Drake introduced tobacco to England, and it soon spread to Europe, Russia, Japan, and Korea. China, Turkey, and Africa weren't far behind in the 17th century. In the early days of tobacco production, tobacco was grown very differently than today. From the 1880s to the 1950s, it took 900 man-hours to cultivate 1 acre of tobacco. According to the Tobacco Farming the Old Way of the Tobacco Farm Life Museum in 2008, the process consisted of cultivating, harvesting, and curing. The final process was for tobacco to be laid out, graded, and bundled to be shipped to the warehouse. After the tobacco was gone to the warehouse, the farmer's job was not done. They had to start preparing for the next season by repairing equipment, buying supplies, planning, and rechinking the bars with mud and mortar to keep the barn airtight. Much like the history of the growing methods of tobacco being different of that today, so is the history of the uses of tobacco. Indians and people in all different countries use tobacco for the treatment of many things. According to Anne Charlton of the Journal of the Royal Society of Medicine in 2004, tobacco was used in different forms such as smoking, chew, and the leaves. A few uses of tobacco include warding off disease and fatigue, making toothpaste, using it as an anesthetic, relieving headaches and colds, and putting it on the skin to heal wounds and burns. It also helped to prevent hunger and thirst. The way tobacco was grown in the past was less hazardous of the health of the people who smoke and those who planted it. Today, the chemicals used to grow tobacco add even more concern. The growing practices are mostly the same of what they used to be, with the addition of chemicals and advanced machinery. A few agrochemicals used to produce tobacco include aldicarb, a toxic pesticide that less than 1/1000th of an ounce is a lethal dose for humans. Chlorophorus, an insecticide that affects the nervous system by inhibiting enzymes that transmit to the nerve impulse. And talone, a toxic soil fumigant that causes respiratory problems, skin and eye irritation, and kidney damage. Today, none of the uses of tobacco are healthy, but there are several ways to consume it. The 2 main ways to consume tobacco are smoking and smokeless. The several ways to smoke tobacco, some of the most popular in the United States, are rolling your own cigarettes, manufactured cigarettes, cigars, water pipes, and pipes. Smokeless tobacco is consumed as dry snuff, moist snuff, and chewing tobacco. Therefore, when tobacco was first being used, it was used as a medicine, but throughout the years, we have learned that it is far from a medicine and that there are many ill effects from using it, in any form. According to the Smoking and Tobacco Use of the Center of Cancer and Disease Control Prevention website in 2010, the risks of the ill effects are greatest in people who smoke or chew. The smoking of tobacco is proven to cause cancer, coronary heart disease, which is a leading cause of death in the United States, as well as stroke and reduced circulation that increase the risk to develop perpetual vascular disease and dying from chronic obstructive lung damage. Then there are the effects of smokeless tobacco, which contains 28 cancer-causing agents. It's known to cause cancer, recession of the gum disease, and tooth decay, as well as reduced sperm count and the number of abnormal sperm cells. But the ill effects don't stop with people who smoke. They are also very clear in people who are around other people who smoke. As stated by the Center for Disease Control Prevention in the Smoke and Tobacco Use in 2010, non-smokers who are exposed to secondhand smoke are inhaling some of the same cancer-causing substances and poisons as smokers. The risks that come from being around carcinogens and smoke are evident, as severe asthma attacks, respiratory infection, ear infection, and sudden infant death are developed in children and infants. In adults, exposure to secondhand smoke is known to cause lung cancer, coronary heart disease, and heart attacks. The growing practices in the beginning of tobacco cultivation are much of those used today, with the use of harmful chemicals and advanced machinery. And although tobacco started as a medicine, it didn't take us long to realize the horrible effects. Today, there are many reasons why people smoke, but the addiction that they form to nicotine is the greatest, as well as the habits they form. Some of the most popular habits are that when they eat, wake up, and when they're driving. As a person that has been around people who smoke my whole life, I have seen these effects firsthand as a result of trying to quit smoking. With all of this being said, my last question is, with 600 chemicals, 4,000 when burned, and 69 of them known to cause cancer, why is tobacco legal?